A very good morning to you. How are you doing? I hope that you're happy, you're blessed. Karibu, karibu, karibu sana. I am so excited to be here because today's discussion is going to be amazing. All right? So karibu sana. Thank you so much for choosing to watch MBCI TV, ambapo tunabadilisha maisha by the grace of God. And today, we are having a discussion that will truly change your life, and that is on Afya Clinic. Because what we do on Afya Clinic is that we talk about everything that affects your health in a way or another. So make sure that you do not miss today's conversation. But even before we get there, I'd love to know how your week has been, what you're thanking God for. From last time we were here, that was last Wednesday. Yeah, so from last Wednesday, mpaka sai, we'd love to know how you've been. What are you thanking God for? There's so much to thank God for. Also, just to make it even more interesting, is that this week, as we told you last Wednesday, is that we're talking about suicide prevention awareness. So, the theme of this month, and today I know we have the CEO of Public Health, so atakuwa anatuambia if we are right or not. But then, this month, we're talking about suicide prevention awareness. And today, on the morning devotion, you had Pastor Elid when he was speaking about why is it that we have people committing suicide and what are you supposed to do, yeah? And it was just more of sensitization and telling people what you're supposed to do. How do you even know when stress? I really enjoyed listening to that sermon today. So, by the way, if you missed today's sermon, Morning Glory, please make sure that you go back and listen. It's on our social media pages, that is on Facebook and YouTube, and I know that that will be a blessing to you as well. So even as we start, we'd love to hear from you. Tell us what you are thanking God for, how your week has been. Also tell us who you are, na to watch kutoka wapi. Okay? My name is Rachel Kahugu. We're going to be here up to 10 in the AM, and I know that today we'll be having an amazing, amazing, amazing time. So officially, karibu sana to Afya Clinic on MBCI TV, ambapo tunabadilisha maisha by the grace of God. Now, today, we are talking about something that is that affects each and every one of us. Yeah, we've had stories of ladies who die during childbirth, or children who lost their lives during the delivery process. And we'd love to know what causes that and how we're able to reduce that, because it's such a joy to see a mom who's gone to give birth na amerudi akiwa sawa. They're healthy, the mom and the baby. Yeah. And the person that you're having today to talk about this particular topic is someone who's very passionate about this. So the other time I had her speaking about this particular topic, I just sat there and I was listening and I was like, you are so passionate about this and I want us to talk about it and address it so that we'll know what exactly you are supposed to do at your level or at your capacity and what we are supposed to do as a community. Yeah, this is not only for the ladies, but also for the husbands, because you have a part to play. Also for the community, because they have a part to play. Also to everyone in general. But I'd just love for you to get a history kidogo about what we're doing today. And that is why we'll be having the In History segment. As you get the In History segment, all the numbers that you're able to get us through is through our WhatsApp number, which is 0721 105 105. Of course, you'll be able to get us on our SMS number, which is 23814, absolutely free of charge. We're live on Facebook on MBCI TV Facebook page, and we're live on YouTube on MBCI TV official YouTube page. So feel free to speak to us and we'll be happy to hear from you. For now, let's get the In History segment.
The history of maternal and neonatal health dates back to ancient civilizations where childbirth was largely managed by traditional midwives and healers. In societies like Egypt, Greece, India and China, women relied on herbal remedies, rituals and community support to assist in labor and delivery. However, the absence of formal medical knowledge meant that maternal and infant mortality rates were very high, with complications like hemorrhage infections and obstructed labor often leading to death. Despite these challenges, cultural practices around pregnancy and childbirth laid the foundation for future advancement in maternal care. During the 18th and 19th centuries, maternal and neonatal health began to shift with the rise of modern medicine and hospital-based deliveries. The introduction of obstetrics as a medical specialty brought new tools and techniques, including the use of forceps, antiseptics, and later anesthesia. However, this period also saw increased risks at times, as hospital environments were often sources of infection before germ theory and hygiene practices became widely accepted. Midwifery, which had been the backbone of maternal care, declined in some regions but remained vital in rural and resource-limited settings. The 20th century marked a turning point in maternal and neonatal health with the development of antibiotics, blood transfusions, and improved surgical methods such as cesarean sections. Public health initiatives including prenatal care, vaccination programs, neonatal intensive care units, NICUs, drastically reduced maternal and infant mortality rates worldwide. Organizations like the World Health Organization (WHO) emphasized safe motherhood and skilled birth attendants as global health priorities. Today, while maternal and neonatal survival has greatly improved, challenges persist on low-resource regions, making equitable access to quality healthcare a central focus in ongoing efforts to protect mothers and newborns.
So that is it about the topic that we are doing today. I know that you now have a preview of what we'll be talking about, and that is just a tip of the iceberg. Is that good English? Is that how we say it? Yeah, so that's just a bit of what we'll be doing today, because we'll be going in depth, yeah? And I'm really looking forward, I hope that you are looking forward for this conversation as well. So if you have any question that you'd want to ask, please feel free to ask. Once again, our numbers are very open. That is 0721-105-105 on WhatsApp, 23814, SMS code, which is absolutely free of charge. We are live on Facebook on MBCI TV Facebook page. We are live on YouTube on MBCI TV official YouTube page. Now, today I'd like for us to have a very open discussion. Any question that you have, if you feel ni kama, a question, it's too light, I can't ask it on TV, please make sure that you ask any question. We can't afford to live in an age of ignorance right now when you're able to have all the information that we need. Yeah? So any question that you have in regards to the topic that we're having, we welcome it. Kabisa, kabisa. Now, today we are having Joyce Nsese, and Joyce is the CO. That is the County Chief Officer of Public Health in Nakuru. And we can't just wait to have this discussion with her, because I told you the other time is that before the segment that we had, is that she is very passionate about the discussion that we're having today. Okay? But just for you to know Joyce a little bit more, we prepared something for you. So let's get into the guest intro, and then we'll be coming back for the discussion. Good morning and welcome to Afya Clinic. Today we are having a very important conversation: how to reduce deaths of mothers and newborns during childbirth. It's a topic that touches all of us, because every mother deserves a safe delivery and every child deserves the chance to take the first breath. To help us break it down, we are joined by Joyce Nsese, the Chief Officer of Public Health in Nakuru County. She has been at the forefront of strengthening community health, digitalizing disease management, and shaping policies that improve maternal and child health. Joyce also works closely with community health promoters and partners on ground to make sure that health solutions actually reach the people who need them the most. We are so glad to have her with us today to share insights on how we can save more lives. I'm your host, Rachel Kahogo. Perfect. So that is it. Karibu sana, Madam Joyce.
Thank you.
We're very happy to have you today.
Yeah.
No. Yeah, she's starting on a very high note today. Karibu sana.
Thank you. Thank you.
How are you doing?
I'm doing well.
Yeah.
And I thank God.
Amen.
He has given me another opportunity to see the day.
Amen.
Yeah.
Amen. Thank you so much for being here. And you're really looking forward to have this discussion today.
Thank you.
I know I've said it so many times, but I'll say it again. I have seen how passionate you are about this particular topic. And I know that today we're going to have a very extensive discussion. But maybe even before we get into the details of it, for the people who are seeing you here for the very first time, that's your camera. Please introduce yourself, say hi to them, and then we get into the discussion.
Hey, good morning, everyone who is watching today's TV show. I really thank God for this day that the Lord has made. We have been planning for it. It has not been working. But I tend to believe this is the day that the Lord has prepared for us to have this kind of discussion.
Yeah.
As we have mentioned, my name is Joyce Ncheche Muturia, which is silent at the end of it.
Yeah.
And I'm a Chief Officer of Public Health and Sanitation in Nakuru County. Now, Umeuliza, what is it?
Yeah.
It is about the public health.
Yeah.
What is it that the public need to know? What is it that each and every person, because public health, it entails all it's needed in health setup.
Yeah.
You, me, what are we supposed to know? So that we can take care of our health in terms of disease prevention, in terms of sanitation, in terms of pregnancies, in terms of even death disposals, in terms of who to call when you are sick, in terms of what kind of food you want to feed on, so that you can remain healthy, in terms of the education that we give to our children in schools. It is a collective responsibility on how health is supposed to be managed. And when you do so, we reduce the diseases that zile zina, you know. If we're able to prevent, we are going to reduce the disease outbreaks, the conditions by maybe 70% or even more, if we're keen on what we do. So prevention is the key. Prevention promotive is key in public health.
I love that. I love that you've said that when you're able to prevent, then tutakuwa na issue ya a lot of people are dying because of you know these diseases. Tutakuwa tumemaliza issue ya outbreaks because we've talked about a lot of outbreaks. So I think that's a very, very, very important thing. Now today we're talking about something that is very crucial. And as you were starting, you started by saying that this is not only for the mothers, it's for everyone in general. And today we are talking about maternal and neonatal health. But maybe just to start for the people who are hearing that for the very first time, what is maternal and neonatal health?
Maternal health basically means the pregnancy and its outcome. The outcomes includes the neonate that is going to be born. So when you talk about maternal health, we want to talk about the preconception, the conception, and post-delivery. What are we supposed to do? What are mothers supposed to do before they get pregnant? How do you prepare yourself to ensure that you carry a smooth pregnancy? Then when you are pregnant, what are you expected to do? Then after you give birth, what is it that preparation you need to have also? Because it is a process. From preconception to conception to delivery. And in this process, it entails so many things. And it involves so many people. The mother who is pregnant, the husband who is also part and parcel of this pregnancy. The community that is supposed to support this mother. The church. The government, the medical fraternity, our CHP, it is a whole pool of team who are supposed to support this mother. So all we need is the basic knowledge of what are you supposed to do at each and every point. Because it hurts me to see a mother die when giving birth. Pregnancy is not a disease, it's just a condition. What is it that we can avert the death of these mothers and neonates? It is very possible to avert them. All we need to know is the knowledge. And to avoid, like, you know, sometimes people think, I'm not going for the clinic, sitaki kwenda, ni mapema sana, ni nini. At the end of the day, even when you have some complications, no one knows. Our teen pregnancies. Watoto wakishika mimba, wanajificha, wanajifunika, tunawakasifu. You know, the way, why is it that a high school girl is getting pregnant, a primary? We're having pregnancies from 10 years going forward.
And 10 is really young.
10 is very young. Very young. That's a baby. But now, instead of supporting, we want now to start questioning how she got pregnant. We want to question our moral status. At the end of the day, we are putting that young girl into depression because of pregnancy. Why is it that we can't support? And then we ask questions later. Who was responsible for this? How do we prevent this? Because we can't also ignore the our culture. There are communities that think that when a girl starts, you know, that can make a wife. How do we teach that community? To tell them, this is a baby, you don't need to touch this girl. Teaching grows hold, mature enough to be able to understand herself, to consent to sex, and to carry a pregnancy. What is it that we need? What information do we need to pass? And the moment we do that, we empower. When you have knowledge, you're empowered.
True.
And that is what now we are fighting for.
Yeah.
What the position of each and every person. The young boys, we are ignoring young men who are making these girls pregnant. What is their role? What are they supposed to know?
You know why I love that so much? Because we talk to ladies about teen pregnancies, but have you ever thought about talking to the men who are also
impregnating these ones? Yes.
Because you talk to the ladies and tell them, you know, teen pregnancy is wrong, you're not supposed to do this is how it will affect your life. But the men, do you really talk to them? So I think that's
an area also we need to.
Yeah.
Because when you see some of these complications, it's because people are not even attending ANC antenatal clinics.
Yeah.
If a young girl is pregnant, you are pregnant, your mother is pregnant.
Yeah.
Are you expecting to be seated in one ANC setup to be seen for your clinic? What is it that we can do?
Yeah.
Even as a government. Nakuru County, let me see.
Yeah.
Under the leadership of our governor, who is a mother.
Yeah.
She's so passionate about these young girls. How do we set up their own clinics? How do we make them comfortable that they don't go at the same clinic with his own mother?
Yeah.
When they're intimidated, even mothers will feel uncomfortable.
Yeah.
So now that's why we are seeing most of them are pulling back, sitting and not going for these clinics.
Yeah.
Till now the pregnancy is seen, till now HPCs or someone in the community encourage them to go to the clinic.
Yeah.
Are they friendly for them? Because now when a death happens from a community, a maternal death, we cannot say hii ni ya mtoto mdogo, hii ni ya mama mzee, hii ni ya nini, and death is a death. A maternal death is a maternal death.
Doesn't matter.
It doesn't matter whether ni miaka 10 ama ni 30 ama ni 50 years. Ours is, how do we make the whole setup comfortable for each and everyone?
Yeah. Okay.
So now it's planning.
Okay.
Nakuru County, they've done a lot because now they have set up even youth-friendly clinics where they can go and express themselves, where they don't integrate with their mothers.
They don't feel intimidated.
How do we take this education even to our schools?
Yeah.
Huh?
Okay.
What is it that we can do? Because some of them even are running to other places. So we also collaborating with even our private partners to ensure that we are getting this data. And the beauty of the thing is the government has also given these young people below 18 years who are pregnant a room to give birth and pay nothing.
Yeah.
All you need to do is have your birth certificate, just go and register.
Yeah.
Yeah.
Okay.
In other facility.
Yeah.
And you get these services for free. Unlike other times when,
You had to
because now
pay.
you cannot, because they need to have a temporary ID.
Yeah.
Below 18 years, they don't have an ID, they
Yeah.
cannot be registered for sure, even when you want to help them.
Yeah.
So now, how do we have these young people? It is to ensure that if they have a birth certificate, they are registered to any other facility. And then from there, they can access these services purely for free. Yeah.
I hear you. And you've mentioned something that you're also collaborating with private partners, the private hospitals and that. But now from the data that you've collected, you know, you might be talking about maternal deaths and people are asking, if story ni serious hivyo sana vile mnaiweka. So what would you say is the state of Nakuru and maybe Kenya as a whole in terms of maternal deaths?
Okay. I think, let me say we are not where we are supposed to be, even as Nakuru County. Because at the moment we have, like I think 2024 we had 52 maternal deaths. And when you try to analyze even those deaths as per the sub-counties, you see that there are sub-counties that have this high burden, and even the wards. We just analyze within the county, at sub-county level and ward level, and see where is this burden, so that we don't have a collective figure. If we know there's an area that maternal deaths are high, then we want to ask ourselves, what are we supposed to do? if we have an area with so many teen pregnancies, which are these areas? I want to applaud the London one in Nakuru County. It's one of the best with the least teenage pregnancy, I think of around 7%.
Oh, wow, okay.
Yeah.
That's good.
Yeah. So what is it that we can borrow from London one?
Yeah.
What is it that we can borrow?
Yeah. What would you say they're doing differently from other wards?
I think that is something we need now to do some investigation.
Yeah.
And they tell us also. We have a stakeholder forum. They tell us what is it that they are doing also to ensure that the teen pregnancies the number is very low.
Yeah.
And even those who are pregnant, they're able to access the medical services freely. I think that's an example I can give.
Okay.
I don't want to say the worst examples because those are the people we need to support.
Yeah.
And that is where we need to pour our energy to ensure that, to me, I want to look for a situation whereby we have a zero maternal death, zero neonatal death.
Yep.
Because that one is preventable.
Yeah, for sure.
For sure.
For sure.
Because there is no condition that cannot be treated.
Yeah.
We are seeing most of these complications are just, they are neglect from the word go.
Okay.
We never manage the process well.
Okay.
So at the end of the day, we have these complications.
Yeah.
And then what I want to tell you is, sometimes there's a lot of complaints about our facilities. Nilienda hospitali, sikuhudumiwa vizuri, nikaingia theater, sikutoka, mgonjwa wangu hakutoka. But what we are not asking ourselves is, what state did you bring this patient in, this client in?
Yeah.
What is it?
Yeah.
If you bring me someone who is gossiping, the chances of whatever I do will be very minimal.
Yeah.
But when you bring me as a mother, with even if they are mothers at high risk, they are managed so well, they know what they are supposed to do, the process will be, the outcome will be good. But now, when you bring me a mother who has been having high blood pressure in pregnancy, eclampsia, and this mother didn't know, sasa ile ameanza kuconverse, ndio tunakimbiza hospitali. By the time wafike hospitali, we are just wondering, ni mtoto, ni pressure, ni nini. So we also put under test. And that is why we want to go deep to the ground and tell people, let's identify these high-risk mothers. Then we put them in high-risk clinics, management, monitoring. What are they supposed to do? Nakuru County has also adopted the system of prompt messages. All pregnant mothers, when they are registered, wanapromptiwa na messages when to attend their clinics. If they are high-risk mothers, when do they need to go for their drug, when their EDD is. So that now we can try to, this gap we don't chin. The intervention that we are taking for the teen pregnancies, I can tell you now we have reduced the teen pregnancies from 18% to around 12% for the last 1 year. So I think we want to applaud our governor for ensuring that the right thing are being done, because for her, she's so passionate about her healthy county. When you have a healthy county, the productivity levels goes high because there's no one who can work then. They are sick. When you're pregnant and then you have other conditions which are not managed, you can't produce. Economy of Nakuru County will go low. Those people who are even accompanying the patient to the hospital, relatives or clients, they also don't work for that day. Their productivity level goes down. Those now indirect costs that can come with all with that pregnant that is not well managed. Then zinakuwa mingi. Tusiangalie mama amekufa. Look at other indirect costs that comes that. Look at the losses that the county undergoes because of that one case that can be prevented.
Okay. I hear you. And there's something you've mentioned about we are not usually very careful about the complications that are there during the pregnancy. And sometimes we don't go for these checkups. And so I realize we're too late sana. Maybe just to go back a little, what are some of these causes of maternal deaths? What are things that we'd look out for that would realize these would at the end cause a maternal or the death of the baby?
There are so many causes of maternal deaths. In our setup, what we have seen causing a lot of so many maternal deaths is postpartum hemorrhage, bleeding after after birth.
Yeah.
Of which now Nakuru County adopted a model to ensure that we avert that one. Now, when these happen in our hospitals, they are well managed. But when they happen at home, like what happened when we were transitioning, there was SHA transition, NHF to SHA. There are so many stories that were negative stories about SHA, about payment. So many mothers even were giving birth at home.
Yeah.
So as more there during birth can make that patient bleed to death. Anemia.
Yeah.
Kuna even antepartum hemorrhage. Kuna those diseases like high blood pressures, high sugars, infections. But you see now all those are all the things that can be prevented.
Yeah.
If you have a prolonged labor, mtoto anatoka amechoka. Resuscitation, uko hospitali utamanajiwa. But ukizalia kwa barabara, ukizalia kwa nyumba. But what we have seen is now people have understood all the theories that were being made about SHA, they were not true. Ati ukienda utalipishwa. Mothers know in any level 3 they go for delivery, the service are free. In any level 1 and 2 and 3, that's a community level. A mother is being taken care of by our CHP. When they go to the facility, when there is referral system, Nakuru County has adopted the PCNs, that's the primary care networks. These primary care networks, they are creating a forum whereby we are taking care of these mothers right from the community. How are we referring these mothers? What is the referral system? Where are the delays? And that is why every Wednesday, like today as we talk here, there is a meeting that is going on to discuss, to audit any maternal death, any neonatal death. And then when we audit those deaths, we try now to go back and see what is it that we could have done and we didn't do it. What is it that even the community could have done? What is it that the mother could have done? Out of that, we learn lessons. We run with those lessons now to preach the gospel of on how to take care of our pregnant mothers.
Okay. I absolutely love that, because now as you're speaking, I'm just thinking how it's our collective responsibility as a whole. Because as you've said, is that sometimes it's the mothers who sometimes you blame the hospital and say, it's expensive, blah, blah, blah. And now you end up preferring to deliver at home. And then with these complications, you're not able to manage them very well. Now, when you met the first time, you were at a stakeholders meeting. And we also talked about the issue of SHA. I know that very soon, before you start sending messages about SHA, hold on, let me explain. Now, very soon, we'll be having a session where we just talk about that, just to let you know, because it's part of our health, and health is very important. So very soon, we'll be having someone who'll be talking about that. We've received very many messages about SHA, SHA this, SHA that, how can I get help, what am I supposed to do? So very soon, we'll be talking about that. But I'm very happy that you've shed light on that as well. And we had a few people even in the meeting who said, nilikuwa na issue na SHA, but I went to hospital and I was treated. So it actually works. And some people say kuna issue kidogo hapa na pale, because it's true, everything that has a positive side has a negative side as well. So we'll be talking about that. But I hope that you've gotten what Madam Jace has said there, because that's very important. I see we have questions that are coming in already. So I'll just repeat our numbers. That is 0721 105 105 on WhatsApp, 23814, SMS code, which is absolutely free of charge. We are live on Facebook on MBCI TV Facebook page. So ukienda kwenye Facebook, you search MBCI TV, you'll be able to get us. We are live there, and you'll be able to just follow the discussion and drop your comment and share the link. We're also live on YouTube on MBCI TV official YouTube page. For now, I'd love for us to get the Vox Pops. This is where we get a few people talking about what they know and understand about maternal and neonatal health, and then we'll be coming right back. So we'll be looking at that, and then as we come, we'll be getting some answers, or we just, discussing a bit about what people know about the same. So for now, let's get the Vox Pops.
A lady who is pregnant, they are basically advised to go for antenatal care, for fetal monitoring, for supplementation, recognition of any complications during pregnancy, And after pregnancy, they're supposed to be checked if the uterus is going back to normal, and also the baby for immunization and stuff.
The main importance umuhimu wa kwenda prenatal ni kujua hali ya ile kiumbe ambacho kiko ndani ya tumbo ya mama. Sababu kile kiumbe ni kama binadamu. So kwa hivyo ni muhimu sana mama ajue hali ya mtoto vile anaendelea pale kwa tumbo. Ndio at least pia hali ya mama isikuwe katika hatarini. So anapoenda pale hospitalini anatibiwa, anaambiwa hali ya mtoto, anaambia pia hali yake iko sawa. Mimi naamini kama mtoto ako sawa, mama pia ako sawa. Postnatal pia inasaidia sana kwa wazazi, wale wazazi wachanga ama wale bado wazazi tayari. Inajua pia hali ya mama iko vipi, kama ameenda pale kwenye kuona daktari, na pia inasaidia pia kujua jinsi ambavyo anafaa pia kulinda mtoto, kulea mtoto.
Ni very important kwa sababu wakati ambapo mama ametunga mimba, ni vyema amtembelee daktari ili huyo daktari aone hiyo mimba imejiplant aje, kwa sababu kuna wamama wengine who conceive inajiplant kwa fallopian tube. Na sasa hiyo ya fallopian tube mtoto hawezi grow hapo. Na huyo daktari ndio atamtuma maybe scan aangaliliwe penye hiyo mimba imeji-implant. Kama imeji-implant vizuri kwa uterus, daktari pia ataona kama iko in a proper place na atamtuma maybe hizo mascan ili aweze kuangaliliwa venye iko. Na when she conceived, daktari ni vyema ajue hiyo mimba atapata mtoto siku gani. Another thing which is good, the doctors always advocate that women should take these IFAs za kusaidia huyo mtoto bone structure yake. Na kwa sababu minerals nyingi mtoto akiimplantiwa kwa tumbo ya mama, mtoto huyo anatumia vitu mingi kutoka kwa mama. So kuna hizo medication ambazo wa mama hupewa, hizo za ku build up the bone structure of the mother and also for the baby. Yes. Yeah, so me I would advocate when a woman gets pregnant, it's very, very important to visit the doctor, because in other cases also doctors check whether your blood ina rhyme na ya mtoto, because most of the miscarriages, they come because maybe the husband and the wife were not compatible. So it is the doctor who assesses all those, checking the blood group of the husband and the blood group of the lady. Another thing, mostly when these women are HIV positive or the man is HIV positive, there are drugs that they are given to protect the baby, the unborn baby, so that the baby is born without the virus. So there are these medication the doctors will prescribe to the mother when she is expecting the baby or even before she conceives. So it is good for a couple, before even you marry, it is good to visit the doctor, because there are those problems that are there. Maybe the guy is HIV positive or the lady, and nowadays they can even marry whether they are positive or not. But at least the doctor has to give them some medication. Okay, after birth now. After birth, you have to take that baby to the clinic. There is that aftercare of the mother. The mother is checked whether she's progressing well, she's getting healed if it is an operation, or if it's a normal delivery, there are those drugs that a mother is given. Also for the baby, there are those immunization. So you have to visit the clinic for the immunization, which help the baby from these other maugonjwa ambazo hupata mtoto. Yes.
It is very important kwa sababu the Bible says in Hosea 4:6, my people perish for the lack of knowledge. Wakati una knowledge ya kujua nini unatakana kufanya, inakuwa ni rahisi sana kupotea. Na kwa sababu Mungu ametupatia wasome ambao wako kwa daktari na kwa hiyo ulengo, mambo mengi ambao wanakufundisha ambao nimediscover, kwanza unafundishwa vile your wife anafaa kukula. Kitu kingine ambao unafundishwa ni vile wife anafaa kulala, ile Saida anafaa kulala. Kitu ingine anafundishwa ni ile uzito hafai kubeba wakati ameshika mimba ama wakati anabeba mimba, ujauzito. Mambo kama hiyo, na unafundishwa ni nini unafaa kukula ndio mtoto akuwe na calcium, akuwe na nguvu. Wakati anakuwa unaelewa mambo mingi. Na usipofundishwa inakuletea shida. Kwa sababu wakati mwingine wakati mtoto anaanza kucheza ndani ya tumbo, utapigwa picha wajue gender ni gani, kwa sababu kuna watu ambao wanafikiria wameshika mimba lakini nakuta ni vitu kama fibroids zinakuwa ndani ya mwili. Anakaa bila kwenda prenatal care. Akifika na wakati wa kujifungua, akienda hospitali anaambiwa we are sorry, au kwa umeconceive, ni fibroids zimekuwa na uko na shida, na hii shida ambayo uko nayo ni emergency. Lakini kama ungeenda mapema ingekuwa ni muhimu sana.
Okay, kuna maagizo ukifika mahali pale. Ya kwanza unaangaliwa. Ya pili unaulizwa chakula gani unatumia. Unaulizwa venye mtoto wako. Kuna ile scanning, lazima mtoto aangaliwe. Kuna ile pia kuna dawa yenye unafaa maybe upatiwe pia unakunywa. Na kuna maagizo pia unapatiwa. Kama uko na shida yoyote hivi kidogo, unaambiwa kama ukae bed rest. Kuna matunda pia unaagizwa ukule, kuna yenye unakatazwa usikule.
Perfect. So that is it about what people know and understand about the pregnancy journey. What do you have to say about it?
I think I'm amazed.
Yeah.
People know what they're supposed to do. Because when I heard them talk, I felt like they're even discussing more than even I'm discussing when I'm seated here. There's a lady who talked about the pregnancy, the process.
Yeah.
Ukishika mimba, enda hospitali. Ukienda hospitali utapimwa uambiwe kama uko na shida. But mimi hata nitasema with planned pregnancies, because kuna mingi they are not planned. Most of them labda they are not planned. But kuna zile planned pregnancy. I will encourage even those who are planning to get pregnant, aende anapimwa. There's someone who talks about the blood group. Unapata mmoja ako na positive, mwingine ako na negative. For those couple, wanakuwa na kitu naitanga rhesus incompatibility. Na mama kuna shindano huwa anadungwa inaitwa anti-D. Tukipata kuna shinda kama hiyo. And sometimes you can even, counseling can be done on what they're supposed to do, other things. Kama ulikuwa na pressure, you manage this pressure before you get pregnant. If you're obese, because when you're pregnant, you also had maybe 10 to 12 kgs that you didn't have. Can you also reduce this weight before you get pregnant? If you're HIV positive and your viral load is high, can we step this viral load iende chini so that now you don't transmit the infection to the unborn baby? Is it now the preconception preparations? You can only get those things when you go to a doctor. When HIV positive, wacha tuangalie the viral load. Wacha to step it down so that now you can get pregnant. And we can tell you the right time to get pregnant. So there is preconception, especially for those high-risk mothers. Even those who are not high-risk, because you don't know sometimes whether you are a high-risk mother, not unless some investigation are done so that we can know. Then get into pregnancy. Tuende clinic. The sessions zenye zinahitajika, wacha tuende zo. Miezi 8 wacha tuende clinic. Tuende tupimwe, tuende tuangaliwe mtoto amelala vizuri, umekula hizo IFAS ameongea about, the lady was talking about them. What kind of food are you feeding on? Because now you are feeding for yourself and for this baby who is unborn. Because you want to give a healthy baby. Ni chakula gani nastahili? The demand of our nutrients are so high. No, how am I supposed to balance my diet? You can only know these things when you go to the clinic. You sit down with the experts. We want to thank God because our CHP, they have a lot of knowledge. And they are passing this knowledge to their teams on the ground. So even by the time you come to the clinic, already less on a CHP what you're supposed to do. We have empowered them with a lot of knowledge.
I love that.
Honestly, they're empowered. Now, we want the church to help us. what is the percentage of Christians? Those people who go to church. Assume on Sunday, si wale wameokoka. Wenye tunaendanga church Sunday, we are Christian. It's a number. How do we pass this information? How do we make our pastors part and parcel of this process? Akisimama pale akihubiri, anataka kuhubiria mtu ako na afya. We need our pastors also to tell our Christian that ukiwa mjamzito endeni hospitali. It's part of preaching. It's a part of gospel. Amesema, someone said, our people die because of lack of knowledge.
True.
Let's pass this knowledge from every corner. If I'm given an opportunity kukuja kusimama kwa kanisa, dakika 5, wamama tuendeni hospitali. Wamama take care. Wamama form support groups of those who are pregnant. We have a group of ladies, tunajuanga, ikifika this year, this date, we are supposed to go for a pap smear. I myself, I may not remember to go for a pap smear. But now, when we are a group na tumeweka mahali, the support system, tutashikana na twende. If one of us was not willing, lazy, anapuliwa na yoka pressure wengine, these mothers, can we also have a support system?
So support system is very
very important. The husbands, they play a vital role. Kuna pia kitu inaitangwa people psychosis. Unapea mama pressure akiwa na mimba, anapata pressure ya life na kwa nyumba na kila mahali. At the end of the day when they give birth, they end up ile tunaita wenda wazimu. We don't need to have that because we need to support our mothers. Everyone, we need to support them.
And it's good that you've mentioned that, because we had someone asking, and sometimes we look at it as a very light thing, but we had someone asking the other time, and I know that we'll be reading the questions that are coming in, but we had someone asking, why is it that some ladies will give birth, and then after that, watakani kama they're going mad? And
si wataka, wanakuanga wenda wazimu. Completely.
So is it the postpartum depression? What happens there? What's usually the cause of that?
Inaitangwa puerperal psychosis. What happens? You may find a situation where this mother was not even ready to be pregnant. You may find a situation whereby when this mother got pregnant, she never got the support she needed. Amestresiwa na bwana, amestresiwa na watoto, amestresiwa na community, kazini, anabeba a lot of pressure. She's not able to. Remember, when mothers are pregnant, the immunity also tends to go a little bit down. They are vulnerable. So, umama amebebana na mizigo mingi ya kizaa, kana trip. And we have seen in many cases, hata mtu anazaa mtoto anaacha hospitali sio wake. So you force his mother to even carry the baby home. When they go home, they need support system also. They want to be treated like any other person who is psychotic. So that is what happens. Now we need to make sure that we support them. You carry a beautiful, lovely pregnancy. The outcome will be as good as the process of carrying that pregnancy. You want to see a baby bouncing after birth, healthy baby, happy mother. See mama nazaa. Let me tell you something else, because I saw someone. Unaweza pata a lady amezaa wachichana peke yake. And there's demand from my husband and my relatives and my community that lazima nikuwe na vijana because I need to be inherited. And we believe it's only men who can inherit, not women. Unapewa pressure. Every time ukichomoa, unachomoa kachichana. Every time ukichomoa. So, the probability of those mothers also getting depression is also very high. Mtoto ni mto, whether it's a boy or it's a girl.
It's a blessing.
It's a blessing. There are so many people who are trying to imagine even how people feel when they are pregnant. There are people who have never given birth. You have an opportunity. Why should someone stress you? To the community, to the people out there. Wajue mtoto ni mtoto, tutoke zile za kale, ulikuwa mwanamke anafukuzwa ndio apati kijana.
That's very wrong.
That is very wrong. And it's still happening, I can tell you. It's really happening. Ndio sasa unasonana mtu anataka. Anyway, but we need to encourage our community, our men. Let men support their wives. Because if men support their wives, the relatives and the community
Yeah.
will embrace it.
For sure. For sure. Now, we have someone who's asking a question here. Asema, good morning. Good morning too. Asema, I have a question. What causes pressure of a woman during pregnancy? And then the second one, Asema, I'm 11 weeks old pregnant with severe nausea and morning sickness. What is the cause of this and how can it be reduced? So let's start with the first one where she's asking about what causes pressure. I think she's asking about blood pressure of a woman when you're pregnant.
What causes pressure?
Yeah.
There are those people who are maybe predominantly, they have pressure, but now because of the hormonal imbalances, escalate pressure,
Yeah.
not even pressure alone, hata diabetes. I would even touch diabetes there. Because kuna kitu inaitangwa gestation, diabetes also. When you're pregnant, unaweza pata diabetes.
Okay.
So inaweza kuwa ulikuwa already na kuna pressure, but it has never manifested itself. Now because of these hormonal imbalances, because of history maybe from your family, unapata pressure inakuja in pregnancy. Kuna zile zinapoteanga after umezaa. Na kuna zile already they are long term now. The same with diabetes. Kuna watu wanakuwa na sukari iko juu, but at the moment they give birth, sukari inaenda chini.
Okay.
So, and that is why we are encouraging people to visit the hospitals. Because you don't know who is you. You don't know your body chemistry. And there is no one who is immune from these things. The families that have diabetes or pressure, the probability of even the other people in the family having diabetes or pressure, it's very high. Ndio unaona mtu akienda clinic anaulizwa, kuna mtu kwenu anakuanga na sukari, kuna mtu kwa familia anakuanga na, because that is something to put into account.
Okay.
Nausea, the other one is about the morning sickness.
Nausea and morning sickness.
It is just hormonal imbalances. It is nothing much, but inaendaga ikiisha with the time. Kuna tudawa twa kuzuia nausea, aende hospitali, angaliwe, even the food you are eating, it's just hormonal. It's just hormonal. Yeah.
Okay, maybe not to get into depth, but for her, she's saying she's at 11 weeks. I know very soon we'll be having a conversation specifically on do's and don'ts while you're pregnant, you know, like everything that we've talked about. But for her, she's at 11 weeks. So for most of the ladies, is there a time, is it like usually in the first trimester or the second or the third, is there a season where you'll say, during this season, there's a lot of nausea and morning sickness, at some point itaisha? I mean, it's different for every mother.
It's different for every mother, but most of them, they happen within the first trimester. The first 3 months. And it goes. Na kuna zile zinasukumana, but they go reducing. But depending. That one is individual. And depend with every pregnancy. You can't say because my pregnancy and this blah blah blah, like vomiting. Like unajua kuna wale wako na hyperemesis, if they are really vomiting and needing, they just go to the hospital, they get managed, and they go home. It goes with the gestation. Avumilie, ameanza kwenda clinic, mwambie anze kwenda clinic also. If they have started going to the clinic, they need also to sit down with their nurses, their doctors, and discuss some of these things. Asikimbie kukunywa madawa.
Also,
without prescription.
Without prescription. There's something that you mentioned, and I think that's very important for us to talk about. When you say that, as you've seen on the Vox Pops, is that people have the information. They know what to do. They know they're supposed to go to hospital. They know all that. But then there's a problem because the moms will still not go to hospital, watangoja mpaka temenyo asikia, ni kama kuna shida. That's when they'll go to hospital. So why is it that mothers, even with the information, they'll still wait for an alarm for them to go to the hospital or to follow the clinics?
Let me talk about our health-seeking behavior. As Kenyans, as Nakuru people, it's not good. For everyone, including maybe you and me. We only go to the hospital when we are sick.
You're right.
And sometimes you just pass to a chemist, ukiwa na kakichwa, acha nipitie ninunue kapanado. will
fact,
not
some
think
of us
about
carry
any
medicine.
complication. And that is why you are seeing people coming to see us in late stages. Hata cancer kitu kidogo ingemanage, unasikia mtu amekuja stage 4, stage 3. Why? Any pain I feel, naenda kununua dawa. That is something that we need to clear from our mind. I don't need to go to the hospital when I'm sick, especially when I'm pregnant. The moment I realize I'm pregnant, the moment I've not received my monthly period, hiyo tu peke yake. I don't want to assume it's because of the diet, it's because of the climate, it's because of hormonal changes. If I don't receive my period, monthly period for that month, the next someone is supposed to do, go to the clinic, enda upimwe. Ni mimba ama ni kuruka. Unajua sasa tunajiambianga we have a lot of answers for ourselves.
And Dr. Google.
Dr. Google ako. So me what I encourage is to change our health seeking behavior. When you're pregnant, go to the clinic. Mwingine atasema nimeenda hospitali, nikapata laini mrefu, nimeenda hospitali, nikafinywa tu, mtoto anacheza, huyo mtoto anacheza, but unajua venye amelala. We have seen mothers coming to our facility, mtoto akiwa amekufia kwa tumbo na ameoza. Yenye tunaita macerated. So now, the moment mtoto achezi una assume kamelala. Because I want to discuss about that because it's happening a lot. We are seeing so many maceration. Mtoto amekuwa mkubwa, you are not monitoring because you need to communicate with your baby. Lea akachezi. Kulala kamelala sana. Kondi labda kamezunguka kakicheza kakafungwa na kondi. Ukisikia mtoto achezi, why don't you go to the hospital? Don't just hear yourself with some information that you know. Ati amelala sana, hajacheza, hajakuwa. By the time unafika hospitali, you also endangering yourself. So let's have some communication. Yako na mtoto, enda hospitali. Hata kama uliambiwa clinic, unaenda after 1 month and you feel. This is to our mothers, pregnant mothers. Umeambiwa enda hospitali, clinic yako ni ya 20th and today is 10th. And I feel this baby has not been kicking well. I feel naumwa na kichwa abnormally. I feel niko na lower abdomen. I feel niko na abdominal discharge. I feel I'm not well. Let me not start saying that ni zile mashinda za mimba. Please go to the hospital. You save yourself, you also save us, you save your family.
And I love that there's something you mentioned while you were starting is that already the maternal deaths are going down. But we're not at a good place. We're still not at a good place.
We're not there.
And as you're speaking, I'm just thinking, it's very important for the mothers to be 100% in touch with their babies. So that, as you said, kitu kidogo, you realize there's a slight change, just go get checked. It's way better than realizing later, hey, I should have done better.
I should have gone.
I should have gone. I should have done this. You'd rather go alafu ambiwe mtoto wako sawa, relax. But just make sure that you go to hospital. Make sure that you go get checked. It's for your sake and the sake of your baby. And I think that's very important. Now, I'd love for us to just look at some of the myths and misconceptions that's around this issue of maternal deaths and pregnancies in general. But even before we get to that, you've been in this field for a very long time, and as you said, is that you've had to speak about this again and again. So let's just start from what are some of these misconceptions and even cultural practices that put the mothers and the babies at risk?
One of these things is, there are so many. The myths. One of them I told you, it's about when we transitioned from NHF to SHA. Wanalipisha, unaambiwa ulipe, there are so many, wakakosa kukuja clinic. The other means you just get is, wamama wakiambiana, ukienda hospitali, ati utaongeleshwa vizuri, hautafanyiwa, you know, ati siwezi enda kliniki kama ziko karibu kuzaa, that is a wastage of time, and I'm okay. Umesikia vitu kaa hizo. Wengine, they will think, hii pesa tunaenda kulipa, thank God nowadays they pay nothing. Hiyo pesa ningenunua nayo kakitu, nipatie mama wa TBA. ule wa kusalisha pale nyumbani, anisalishe. They feel,
Yeah.
tu vitu twa like, na akizaa, unajua kuna wengine, I was having some makafora somewhere. Hata wenye wanazaliwa nyumbani, they believe, wanapaka hiyo the code matope ya ng'ombe. Under discussion akisema, na sio daktari, mtu akipaka inaponeshanga haraka. Comes a what? Mafi ya ng'ombe. Do you know how many bacteria are there kwa hiyo mafi ya ng'ombe? Including tetanus zenye tunaongea na vitu mingi. Huyu mtoto anapata infection, huyu mtoto anakuja hospitali akiwa very sick, we lose that baby within the first 28 days. What are we doing? Mtoto anagonjeka, unakimbia kununua dawa kwa chemist. You don't know what you are buying. You give mtoto antibiotic, unapea mtoto madawa, sijui fever, nini. At the end of the day, you bring that baby to our hospital, mtoto akiwa extremely sick. Dehydrated, you can't even access a vein to give a drip. Why don't you take your babies to the hospital? Wewe mwenyewe umetoka hospitali, you are seeing some abnormal things in your body. Why don't you go back to the hospital? Ati unasema, siwezi enda hospitali. Ni ile tunajua. You know, there is that what we know and what we have been knowing. And we know wrong things. Kwa nini usiende hospitali? So sasa zile kimeumana, tunakimbia wapi? What miracle our doctors going to perform? Tunataka kusaidiwa. Tusaidiane. So that we can also manage people well. So unaona tukichapwa. Like, there's something else I want to say. If someone dies, unasikia wakisema that is a deathbed. We are delivering like 1,200 babies. Maybe we lose one or a mother ile. But the kind of noise, the kind of insult that comes to us depresses us. And what I can tell you today, there's no one who gets stressed and depressed like a staff, a nurse and doctor in theater who loses a mother. They get depressed and they need to be by us. As a community to make noise, there's no one who thinks about the staff who was conducting that delivery.
How is she? Or
how is she? We are human beings. We need to be comforted.
We never think of that with it.
There's no one who thinks about it. And I can tell you, when you get people crying in a maternity, crying in theater staff, getting depressed and going to their homes. Mtu anashindwa kufanya kazi mpaka anaenda kwake kwa nyumba. Because losing a mother or a baby. People think we have seen a lot and tuko sawa.
Do you ever get used to the environment?
What?
No.
Can you ever get used to a death?
True.
Especially we are trained to save life. So if you don't save that life, you count yourself like you have not succeeded in what you're supposed to do. You are failure. Unajiona ni kama kuna mahali, but at times kuna vitu inevitable. There are things that are inevitable. And there is no one, people struggle to save a life. Even that patient who is brought gossiping. But when you lose that patient, the first person to be depressed, it is the caretaker who was taking care of that patient. So watu wachange kutokana madaktari. Ukiona daktari amepoteza mtu kwa theater ama in hospital, in the ward, the first thing is consult with that staff. Encourage that staff. So that they may get even strength to handle the next patient.
All right. I hear you. That's something that we don't think about. I think it's a very important point that you've raised. It's a very important point that you've brought. Now, we'll be taking a very short break. As we come back, we'll be looking at some of the myths and misconceptions that surround the issue of maternal deaths and also pregnancies in general. So if you have any that you'd want to ask, please feel free. We'll also now be answering all the questions that are coming in. Okay, so we take a very short break and then we'll be coming right back. Usiende mbali. This is Afya Clinic.
MBCI Television, transforming lives.
Gen Zs ni hawa vijana, sana sana hawa vijana wako young. Na Homo habilis ni wa generation gani?
Shut up everybody, listen.
Tulikuwa na Homo habilis na Homo sapiens. Homo habilis ni ya saizi sasa. Sasa hii ni kama Gen Z sasa.
Kuna huyu mtu kwa Biblia mwenye alikula asali kutoka kwa mzinga akiwa msituni. Alikuwa anaitwa nani?
Forester. Forester.
Ponea chupuchupu, funika gubi gubi. Sawa, ngangana?
Ngangana kisabuni. Ngangana kisabuni.
Funika gubi gubi, ngangana?
Kisabuni hiyo.
Nairobi, a new sound has risen. 96.9 FM, commanding the airwaves, breathing life into every home, a sound of hope, a voice of truth, a well overflowing with living water.
Kuna mipaka tumesukuma, kuna mahali hatukuwa tumefika maeneo katika redio yetu ya MBCI, lakini hayo maeneo sasa Mungu anatupa. Tunaingia Nairobi, tunaingia Mombasa, tunaingia Marindi, tunaingia Ramu.
A station with one divine mission, transforming lives. From soul-stirring worship to life-changing conversations, we speak light into the darkness and faith into the heart of the nation. MBCI Radio, tunabadilisha maisha. Now broadcasting from the heart of Kenya's capital, Nairobi, 96.9 FM and beyond. The sound of heaven, right from where you are. My station, in my city, for revival. MBCI Radio.
Are you a woman minister or a minister's wife navigating the unique challenges of your calling? Then this is for you. Abigail's International Ministry proudly invites you to a powerful, life-changing one-day seminar exclusively for women ministers and ministers' wives. Theme: Challenges faced by women ministers and ministers' wives. Date: Saturday 13th September 2025. Time from 10 a.m. to 4 p.m. Venue: Kingdom Seekers Fellowship, Thika Road. Get ready to be empowered, refreshed, and connected with other women who understand your journey. Featuring the dynamic and anointed Pastor Julia Karanja, a woman with a word that will transform your walk and renew your strength.
Uweza wako wa ndani ndio unakusaidia kupigana vita na kushindana.
Entry is absolutely free. Lunch will be served. Register now on 0726 341795 Pastor Regina Nduru or 0720 577 544 Pastor Maggie Dawn. Don't miss this divine appointment. Come, connect, and conquer.
When the ground moves, only strength and precision can get the job done. At Rift Valley Heavy Machinery and Professional Training Institute, we don't just move the earth, we move possibilities. Equipping professionals with world-class training, innovation, technology, because every project demands expertise. So, are you ready to power up your career and take control of your future? We train you to operate all kinds of machinery: shovels, bulldozers, excavators, graders, rollers, and many more. At Rift Valley Heavy Machinery and Professional Training Institute, you get more than just skills. You learn basic mechanics, plant mechanics, first aid, defensive driving, driving, and even take refresher courses. We also offer courses in hospitality, cosmetology, ICT, cottage industry, mechanical and electrical engineering. And guess what? New students get a 10% discount. We conveniently located in Subukia along Nakuru-Nyahururu Highway. Call us on 0707 539423, 0707 539423, and start your journey to success today.
MBCI Television, transforming lives.
Good, we're back. Thank you so much for staying. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. And of course the show on air is Afya Clinic, where we get to talk about everything that affects your health. My name is Rachel Kahugu. I'll be your host for the day, and I am very excited to be having this discussion. Now, we are having this discussion with Madam Joyce. She is the CEO of Public Health in Nakuru. And we are continuing with this discussion about maternal health and why it's very important for us to make sure that the mom is healthy and the child is healthy during the pregnancy season and after delivery, because that's very, very important. And we were looking at some of the misconceptions and the myths that surround these. And I'm very interested to hear what people would say. But before even we go to the messages that are being sent already, let's look at the mythbusters. So these are some of the myths that we've collected, that we've seen, ambazo watu wanasema sana about the pregnancy journeys and getting babies. So the first one on the mythbusters is that pregnancy is a natural process, so medical checkups are not necessary.
That's a wrong one.
Yeah.
Yeah. That one is it's a misconception. It's a myth.
Yeah.
And it is misleading. A pregnancy is a condition, and it needs to be monitored from day one to the last day.
True.
And even after.
Yeah.
Both for the mother and for the baby. And I think I gave all the reasons that the reasons why it's supposed to be like so.
Yeah.
Why we need to monitor our pregnancies from day one, before conception, and even during conception and after.
Yeah.
So it is not, si kawaida. Na hiyo kawaida thing, that is why we are seeing many problems coming up.
Yeah.
And the only people to be blamed are the medical team. No one is looking at those misconceptions, myths that comes.
Yeah.
So that is why we need to demystify all that, so that we can reduce our maternal and neonatal deaths.
Yeah. Okay. On to the second one is that a woman should eat for two during pregnancy. Is that true?
Eat enough, eat a balanced diet.
Yeah.
You're not eating for two. You're not eating 2 plates.
Yeah.
Remember, the overweight, the issue of overweight. You can eat for 2, but what are you eating for 2? One of the things you need, eat the normal food you eat, and balanced diet.
Yeah.
Period.
I love that. So take a balanced diet, not at 2 plates, eat
At
a lot of
tanine,
food.
ugali na cabbage, na mamaliza yangu, na kula ya mtoto.
Sasa. Also, it needs to be very balanced.
It is supposed to be very balanced.
Yeah.
You need to eat a balanced diet.
Yeah.
Because you and the baby need this food. Eat at the right time.
Yeah.
Usiamkange saa 8 usiku kukula sababu umesikia njani ya mtoto.
Yeah.
Just eat normally.
Okay.
Keep yourself healthy.
Yeah.
Have exercise. Unajua sasa kuna hizo myths pia, when you are pregnant you cannot exercise.
Yeah.
I think we need to have these well-being clinics for pregnant mothers.
Yeah.
This is the right time now tutakuwa na gyms. We need to have hata gyms za mothers.
For pregnant women.
We need very good blood circulation. Si miguu kila wakati kufura, ikifura unasema ni uzito ya mtoto imekulalia. What is it that we can do also? What are the best practices that can adopt to ensure that we are not having swollen limbs, you are not lethargic?
I hear you.
Tunakuwa na wellness clinic ya wamama where they can go, they do their gym, they're supposed to be told what to do, friendly, what way, what kind of weight to lift. Happy pregnancy.
I hope there's someone who's listening and they've already decided that they'll open a gym for pregnant women.
Pregnant mothers.
Please and
I would
thank
love
you.
to see that.
Yeah.
Yes.
Yeah. No, kifungo tuite tukuje tuone. That would be so good. All right. And the other mythbuster is that cesarean delivery is always easier and safer than vaginal birth.
Cesarean is good, but it has also its own complication or something. But what I've seen nowadays is women are preferring to have cesarean section because watu wanaogopa uchungu, they fear pain. But a vaginal delivery is equally good. It's natural. Not unless you have some complication. Sometimes unapeleka mtu theater because mtoto kichwa ni kubwa compared to the size of the pelvic. Mtoto amelala vibaya. You know, those kind of thing. Ama mtoto amechoka. Na the process of kumzaa normally ita take long. Unasikia watu wakisema mtoto amekunya kwa tumbo. You see those things, But I'll encourage normal delivery if you have no complication. Let your doctor decide. But if you want cesarean section, you can also discuss with your doctor. It is not it's not a rule.
For sure. Now, I also see someone else who was asking, can you get more than 2 kids through cesarean section?
Oh, yes. Why not? All you need to do is to let your uterus heal. I have 4. All through cesarean section. So anything is never had any complication. So all you need to do is discuss with your doctor. They'll guide you.
I love that. Now, we have someone who's asking, I got my firstborn through CS. What can I do to avoid the same with my secondborn?
It depends on why you went cesarean section. If your pelvic is small, you can't, there are things that you can't change. But it was because of something that can be discussed and prevented, then you don't need to. It does not mean that when your first pregnancy you gave through cesarean section, that the second and third you get them through cesarean section. Maybe mtoto alikuwa amechoka that time. Now this time, ama mtoto wako ama the pelvic ama nini. If it's something that is manageable, I've seen so many people with the first pregnancy or the second, ama anapata normal, then the second because of different causes of maybe obstruction. Ama why you went to theater. So depending on the reason, let her go discuss with the doctor and give the previous history of that. Why did you go to theater the other time? Mtoto alikuwa amechoka, ama ni jia uzazi ilikuwa kidogo, ama ni mtoto alikuwa amelala vibaya. What was it? Out of that, then they can have a dialogue with the doctor.
Okay. Anauliza, what are the causes of consistent headaches during early pregnancy?
Headache is a symptom of something. Kikumo na kichwa si ugonjwa. It is a symptom of something else. It is good for that person to go. Inaweza kuwa ni pressure iko juu, inaweza kuwa ni kasukari kako juu, inaweza kuwa akunywe maji ni dehydration, inaweza kuwa ni mawazo. It can be a collective. It is a symptom. I'll encourage that person who has that question to go to the hospital and be apimwe vitu mingi tujue what is a healthy condition. Because kichwa ni symptom. Aende hospitali.
Okay. A very interesting question here. And Anauliza, look, you mentioned gazaping. What is that?
Gazaping.
It's fine.
Ni kama, how do I put it? Unapeleka mtu hospitali kama akona zile, ana breathe zile za mwisho. Ni kupumua ile ya mwisho. Ile. You understand? So hiyo ndio tunaitanga kwa lugha yetu gazip.
And what's the cause of that?
Sasa hiyo ni kuonesha na your respiratory system is fully compromised, now you're at your final stages of...
Is it something that can be managed?
The only way to manage that is to ensure that you don't allow yourself to get to that stage without seeking medical attention. Because ni kuonesha umekuwa mgonjwa kabisa mpaka unataka kupumua zile zako za mwisho. Unakimbishwa hospitali when you are almost breathing your last. So the only way is ensure that you go to the hospital, unamanajiwa, because I mentioned that one when I was talking about patients who are brought to us when they are very sick. Very sick. So inakuwa difficult for us even to save those lives. You struggle, but sometimes you don't make.
Okay. I hear you. Now, we also have another question. Hello. Is there any effect if you get pregnant and you have a baby who is 2 years, 5 months, and you had 2 CSs? Is there any complications? Please advise.
I don't think there's any complication because that is a uterus that has already healed. So just monitoring to the clinic, let them get checked, let the person who has read that medicine be checked and go to the hospital. But literally, that uterus to me has healed.
Okay. At what point is a mother put on bed rest?
At what point is a mother put on bed rest? When the pregnancy is threatening to come out before its due date. If you have something, that you have some, tuseme maybe uko na low lying placenta, the cervix is inataka kufunguka, maybe you have a condition, unawekwa on bed rest. Depending on what you have, why you are complaining. Because sasa kama uko na a lot of pressure on your lower abdomen, the cervix won't open when the baby, you are not due, utawekwa on bed rest.
What does that look like? What does bed rest mean?
Bed rest means ukae kwa kitanda, umelala, no much movement.
Because I understand there's a discussion that we are having and there's a lady ambaye aliambiwa uko on bed rest. So ako tu nyumbani but anafanya kila kitu nyumbani. And I'm wondering.
No, ukiambiwa bed rest, wewe kaa kwa kitanda. Na kama uta manage because of so many responsibilities you have at home, tutakuweka kwa ward, ukuwe na bed rest. Then when you are stable, then you discharge you home.
Okay. Now, I see we have questions that are continuing to come in, so I'll just repeat our numbers so that our numbers are very open. That is 0721 105 105 on WhatsApp 23814. Our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. And we are ready to hear your questions. We are ready to discuss this because it's a very, very important topic that touches each and every one of us. When we started, we said that this is not something that only affects the ladies or the moms. It's something that affects us, everyone, the men, the community, the moms, the kids, the family. And that's very important for all of us to know. There's something that you mentioned, Doc, that you're not only looking at the day of the mom that we are seeing, it's also everything that is surrounded by that. The fact that mwenye amemleta hajaenda jobi usiku, which means they weren't productive that day. So it affects so many things. So just saving this one mom saves us as a community. And that takes all of us. Now, what is the part of the community? You mentioned about a support system. And you said that for the husband as well, it's very important for you to be very supportive to your wife or to the mom who is expectant. But what's our part as the community? What are we supposed to do? And this is to everyone that's listening to us today. So, what's their part to play to make sure that this mom who's pregnant, kama it's a teenage pregnancy, ya kwamba the pregnancy imeenda vizuri, na the baby is delivered healthy.
Thank you, Rachel. I think community has the biggest role to play when it comes to pregnancy. And community, it is all of us. The church, the local authority, the CHP, the family. The family, I mean including the husband. We need to support this person who is pregnant. In terms of love, we need to love them. We need to remind them they need to go to the hospital. We need to remind them the danger signs. We need to talk, to engage them, and to have the support. Like what we're feeling, like ukiumwa na kichwa, kuna mtu ameuliza, nikiumwa na kichwa, I'll share with my people. The dialogue days that we normally have during our primary care networks. People come, ask the questions, and we want to thank God that nowadays we have GHP on the ground. Wako in every village. Tunaita units. In those 2 villages, you know, it's easier for you to know. And what we have adopted in our system, the county government of Nakuru, we have adopted a system whereby we want to know. I think we started last month. We want to know you as a community health person in that unit. How many people are pregnant? Si ati kusema ati ngani knows blah blah blah. How many people are pregnant? And then out of that people, how many have given birth? And what is the outcome of those pregnancies? By doing so, it will be a responsibility of people to know, kuna watu wa mama wangu wako na mimba. Wengine uficha. Unaificha, unaficha. For our young girls. That is why we are going to schools to give education on some of these things. Ukiwa na mimba, usifiche. What is the role of teachers? Na kitambo ulikuwa unashika mimba, the first, I remember when we were in school, the first day we report in school. Kastrip. And ulete makojo. Unaona? And from there, intimidation starts. You are chased away from school. If a mother can work when pregnant, mpaka last day I ended hospital, what will make this girl not go to class, learn? It's not the brain that is carrying the baby. Ifike siku zako uende uzae, we take care of that baby, you go back to school. Days are gone, whereby mshana akishika mimba tulikuwa nafukuza. And who is impregnating these people? Let's bring our boys on board. Let's bring our men on board. Wacheni na watoto wasome. Na accidentally akishika mimba, because let's support them. Period. And when you do so, to reduce even the abortion and death that are associated with pregnancies. Because unajua mtoto akijua nitashika mimba nitafukuzwa nyumbani kwetu, the next thing I would think about is how to flush that pregnancy.
And I'm happy that you mentioned that now we have the number of teen pregnancies going down, because that's what's important. If you show them that you hear them, you support them, and teach them about why it is important for them to take care of themselves. Now, I'll share something. When I was going to high school, and I think this is something that we should do as a community. I remember something, of course, as a very young girl, my goodness. I have just remembered it right now, but I think that's very important. When I was going to high school, there's something that my parent told me, and he said, now that you're going to school, you have to know whatever you decide to do with your life is up to you. This is home. So mess up, you'll come back home. I'm still your dad. But if you get a baby in high school, it's your life that will derail kidogo. You'll be loved at home. You'll be loved in the community. But it's your life that will derail. So it's for you to make the choice. And now how I think about it right now is for us to tell the young people, we love you. You'll come back home. But then know that your life won't go as planned. So that now they are at a point of them making that decision. And knowing that, one, this doesn't please God. Two, it's my life that will derail. Si mtu mwingine yoyote. So I love that you mentioned that we should give them as much support as we can.
And we want to have youth-friendly facilities. Like now we have at Naivasha, Gilgil, Rongai, Joro. I think Rongai and Joro. We want to have youth-friendly clinics where they can come and even amenities where they can come and play, where they can come and exchange ideas. Want to make them comfortable because one of agendas of our governor is to ensure that the youth are catered for. Someone is listening to the youth. They are being supported. It's not, you don't support them with material things only. You support them with knowledge, wisdom. to make decisions about themselves. And that is what we're working towards.
Okay. Okay.
Because I
Very
think
important.
we have been thinking about, when we think about supporting youth, we think on material things. We don't think on social supporters.
We think about jobs.
Jobs. Sina kazi. But if I give you ideas of how to get a job, when we share ideas, when you are wise, you can think outside the box on how you can make money. Yeah. See ati nikuje, you know, there is a lot. There's a lot that we have not harvested.
I hear you. Now, I see we have questions that are coming in, and I usually just think about first-time moms and how you'd be very confused because you're doing this for the very first time. So this is where you get help as well. Okay? She's asking, hi, good morning. Kito vya mtoto inakatika na siku ngapi? Cause mtoto wangu ni 5 days na bado iko tu. What do I do? Yani, I'm just seeing the frustration of this mom, or the confusion that she's having right now, and she's wondering, God, what happens here?
Ina depend. Kuna yenye nakatika na 5 days, na 1 week, na 10 days. I was and traveled over the weekend, and there's a mother yake iko imekatika na 1 month, and was like, tuangalia akana infection kako sawa. Let them give it time. Itakatika tu. Haitaishi hapo milele. Because that's like a dead thing. So it will just cut off by it, as long as it's not infected. If it's infected, anakaosha tu, na kama kakona infection, anaenda hospitali. But the rest of the things, clean it too with cassava, clean. That is all. As long as it's clean. Haipia nafasi itakatika tu.
But anataka nampeleke hospitali just to check and make sure she's not, the baby is not infected.
Unajua ataangalia when a baby is infected, the temperature is go up, the baby will be uncomfortable, not breastfeeding well. So now utasikia, it's smelly. It's when a wood is infected, definitely you'll know.
You'll know. Okay.
Kama anajua kukaosha vizuri. That is it.
Okay. Perfect. Time is really moving. I hope we'll be able to read all the questions. Anasema, please shed more light on the weight a mother should carry during pregnancy.
There's no specific weight because our bodies are different. But during pregnancy, be assured that there are people who are between 10 even to 15 kgs of weight. What I encourage myself, if you know when mega with weight, you are generous with weight. Before you get pregnant, try to reduce that weight. Because obesity comes with its own complications also. The breathing issues, all those kind of stuff. If I'm asked a planned pregnancy and you think your weight is not favoring you, try to reduce that weight first, get pregnant. Watch the kind of food you are eating. Sit down with your dietitian, with your nutritionist, discuss on how you can cut that weight.
Okay. Perfect. Jerob Irene, I see you're saying that you are ready to learn. I hope that you're learning already. We see Mwas Kamas Mwangi. I love that you have men who are tuned in and they're commenting.
I'm happy.
I love that. So big up to you.
I love it also.
And share this with many other people. This is really amazing. Tukana Mwangi Wairago, I see you. Thank you so much for tuning in. Tukana Helen, I see you. God bless you. Tukana John, I also see that you're following. Thank you so much for following. Also, I would just request for us, if you want to say something, please text. You might not be able to pick calls right now, as you can very well see. But I'd ask you to just text, and we'll be able to get your feedback. Now, I'd love for us to get this amazing segment, which is Healthy Living, that just teaches us exactly what you're supposed to do to live healthy, and it is in line with the topic of discussion that we are doing today. And immediately after that, we'll be coming right back.
Good morning and welcome to Afya Clinic. Today we are focusing on a very important topic, maternal and neonatal health. This is all about the well-being of mothers during pregnancy, childbirth, and after delivery, as well as the health of the newborn babies during the first 28 days of life. Why is this important? Because a healthy mother means a healthy baby, and that's the foundation for a healthy society. Every year, thousands of mothers and babies face preventable health risks simply because of lack of care. So, what can we do to ensure safe motherhood and healthy newborns? Here are some key tips. Number 1, start with early antenatal care.
Visit a healthcare facility as soon as you know you are pregnant. Doctors can monitor your blood pressure, nutrition, and overall health. Early checkups help detect conditions like anemia, diabetes, or high blood pressure that can affect both mother and baby. Number 2, eat a balanced diet. Expectant mothers need plenty of nutrients, that is iron, folic acid, calcium, and protein. Include foods like green leafy vegetables, beans, fruits, eggs, and whole grains. Remember, you are eating food too, but that doesn't mean eating twice as much. It means eating twice as healthy. Number 3, prepare for a safe delivery. Deliver in a health facility with skilled healthcare workers. Avoid home deliveries unless you have trained midwives and emergency support. Number 4, care for the newborn. The first 28 days are critical. Practice exclusive breastfeeding for the first 6 months. It strengthens immunity and provides all the nutrients your baby needs. Keep the baby warm, ensure proper hygiene, and follow their immunization schedule. Number 5, watch out for danger signs. For mothers, excessive bleeding, severe headaches, or swelling can signal complications. For newborns, fever, difficulty breathing, or poor feeding require urgent medical attention. Maternal and neonatal health is not just a mother's responsibility. It's a family and community effort. Let's support our mothers with care, good nutrition, and timely medical attention. Remember, a healthy mom and baby means a healthy future. Thank you for tuning in to Healthy Living. Stay informed, stay healthy.
All right. Thank you. Thank you so much for coming. Thank you for being here. That's such an amazing segment that we've had right there, and I hope that you've learned a thing or two. Now, today we're talking about why it's important for us to make sure that our mothers deliver safely and our kids are healthy even after delivery. And we've talked about so many things, we've answered so many questions, and we are hoping that you've gotten at least a thing or two. But if you've joined us a bit late, we'll be having Mombi, who'd be helping us go through everything that we've done today, right from the top. Sawa. But also with that is that we've been live on Facebook and YouTube, so you can always go back and check everything that we've done today and share the link. Please share. Yani leo, I'll ask for us to share, because today is more of sensitization, just to get to understand what happens. Why is it that we have mothers who deliver and their babies die, which is very sad? Or why do we have a mother who died during delivery? Yeah, so it's very important for us to all understand what happens, for the husbands to know what's their part, what kind of support are they supposed to give. I actually really loved during the Vox Pops, there's a man, there's something he said, I even mentioned, there's a man who talked about something about the wife, probably food yenye the wife anatakana kwa kikula and things like that, and I absolutely love that, because that means that the husbands know they have a role to play in this journey. The community should know they have a role to play in this journey, and that's super amazing. And to help us with this discussion, we have Madam Joyce, who is the CEO of Public Health in Nakuru. So thank you so much for being here today. We are having an amazing discussion, and I'm absolutely happy and grateful that we've been able to talk about this. Yeah. Now that we're talking about mothers, what would you tell a mom who is pregnant right now, or who's planning to get pregnant?
The message to mothers who are planning to get pregnant, let them consult a health professional to advise them the preparations before pregnancy, because there are so many. What do I need to know before I get pregnant? Knowledge is power. It is. When you are pregnant, please, and you have not started attending your ANC clinic, kimbia. Go to the nearest health facility, get checked, do the antenatal profile, check your status, including the HIV status, because they are all important. And ensure that you have all your extraction for your ANC.
Perfect.
Without, it's like, make sure you attend clinics the way you're supposed to attend, monthly, for 8 months.
Without fail.
Yes, without fail.
Without fail.
Yes.
We never talk about this enough. After the baby is delivered, tunatakana kumpeleka hospitali up to what point? Because I feel like for mothers, when mtoto ako sawa, we are good. Unless they have a problem, they have fever and stuff like that. But as long as the baby is okay, we'll just stay at home.
Kuna zile vaccination zenye the babies are supposed to be given.
Yeah.
Mothers are always told during birth, this is what we give.
Yeah.
After 6 weeks, this is what we're supposed to give. Till 9 months,
Yeah.
till 5 years,
Yeah.
you are supposed to take your baby for clinics till the babies are 5 years old. Yes.
Yeah.
And in every stage, there's something, either it's weighing alone, either there's a vaccine you're supposed to get during the CNC clinic. Ensure that you take your child to the clinic. It's monitoring. You are monitoring the growth of that baby. And the only way to monitor is by checking the weight of that baby, having a discussion on how you're bringing up the baby. I believe there are people who used to say that there's no one who goes to class to be taught how to bring up a baby. You just bring those babies the way you know. Your own. But nowadays we tell mothers, come we discuss, come we share experiences. Because they are babies, they are growing at the same rate. We need to give them right environment, the right food, breastfeeding. Don't give your babies atima ugali, those foods before they get to 6 months.
Yeah, sure.
And then after 6 months, introduce slowly. You don't, because now I'm 6 months, I need to even get there, I want to correct. Just discuss with other mothers. Let's join these forums.
That's very funny. Yeah, especially for the first time moms. I feel like that's very important, just to know what exactly you're supposed to be doing where.
As in when the baby cries at night, Ati, I'm not having enough milk to give this baby. I need to give porridge. I need to give mashed potatoes, malenge. You know, those kind of things. Please don't. Your breast milk is enough for that baby for the next 6 months. Does not need that food.
All right. Perfect. Let's talk about SHA. How are they supposed to enroll for SHA? What's the process?
That is another topic I love. That is another topic that is of interest. And as Nakuru County, our governor is the ambassador of SHA. Because without people being registered for SHA, it's difficult for them to access the services. Register, we get that money. Level 2 and 3, you know, people are refusing to pay to register because of the means of testing. They will be told to pay a lot of money. But what I would encourage our people today, the Nakuru people, kindly go and register. If you feel that you don't need to go to the means of testing for now, just register. Level 2 and 3, the services are free. That is primary health care. And then, when you need to pay, you need to go to higher level, the level 4. You need to be a paid up patient. Our mothers, level 2 and 3, where we get these services, completely free. When you go to give birth, even at level 4, it is completely free. Walk in, walk out. But ensure that you register. You are a registered person. For this count to get money, you need to register. When the two are registered, means of testing, some of them are complaining that they have been told to pay a lot of money. If you feel what was given to you is not what you are supposed to pay, the SHA offices are open 24/7. Go there. The branch is here at Nakuru. Complain, and then they will guide you on how to re-register again and get the right figure for yourself. Because you have seen people discouraging others. Mimi nimepatiwa sijui pesa ngapi. This is a system. It can have an error. When there's an error on your side, it cannot be an error to other people. Just register. For now, we are telling people to register. You register. The means of testing, we'll tell you where we need it now. But for now, the lower level, 2, 3, community, less people register. And I'm very happy. Since the time our governor started advocating for this, we're almost hitting 1 million. People were registered in Nakuru County. But we are still not yet there. We have another 1 million to go.
And I love that you've you've explained it, that part so well, that once many people have registered, as Nakuru County are able to get the funds that we will now use to get hospitality, because that means ukiwa na SHA, you won't be paying cash in hospitals. But if many people haven't registered, then that would be a problem. I'm saying that because I've seen and I've heard stories when we were in that the stakeholders meeting as MBC, and we'll be telling you more about that. In the stakeholders meeting, you had one person who said they had someone who was admitted and bill yote kalipwa na SHA. And I thought that was very amazing, but kama hakuna funds kwa SHA, then hatutasaidika.
Exactly.
So I absolutely love how you said it.
And then you see now, people, the way the way SHA is working is much better than NHIF. Approvals, they're almost immediate.
Yeah.
The reimbursement of other facilities, almost immediate. So when we started, it had a lot of challenges, like any other system. We had so many challenges. But I'm telling you, as we talk now, we're enjoying the fruit of SHA. Let people go register, let people pay. When we talk about universal health care, it's pulling our resources together. We buy this good. You know, we are buying health. That is a good, the way we buy mkate kwa supermarket. But now, when we pull our resources together, we buy it at a cheaper cost. Unlike you going alone as a person. When we pull ourselves together, and that is why we're telling so many people to register. Let's register. Let's pay. Let's boost our kit.
Okay. I love that. Now, I know we have questions that are coming in about SHA. As you said before, is that we'll have time when we'll be talking about that specifically. If we start talking about that, we won't have enough time to exhaust it. And I see that we're short of time.
SHA person to come and talk about it.
Right? Yeah, that would be very important. Now, we have a question here that I wouldn't want us to miss as much as I see time is not together with us. And so I had a baby who died before delivery, almost to deliver. The scan showed it was almost 2 months. The cause, I don't know. I was going for clinics. I was being told the baby is doing okay. But to me, I had a doubt. They said about the amniotic fluids. Please explain.
Come up again. Let me get it right.
I had a baby who died before delivery, almost 2 months to deliver. The scan showed it was almost 2 months. The cause, I don't know. And I was going for the clinics. I was told the baby is doing okay, but I had doubts. Yeah, but they said something about amniotic fluid. So Anasema, please explain.
I'm not very sure about it. And the scan was good because there are so many things that can cause even birth abnormalities. You know, when there are birth abnormalities, start pregnant, sometimes it will come out. The amniotic fluid might even be a lot also. So I don't really understand, not unless I engage with her to get more information so that I'm able to answer that question. I'm not able to, I'm not getting her well. I need to. And then to have the report, if she has a report of those scans, so that now to avert the death again, just in case there's any issue. Even that racial incompatibility can cause that also. There are so many things. We need a discussion with her, or she just let her go to the nearest clinic to ask more questions, and let her carry all the documents that were being used by them.
And then it's the fact that she's saying ya kwamba aliambiwa scan iko sawa, but she still had doubts.
Nikitoka hapa utampatia namba yangu kama you able to access the person. Mpatie namba yangu, then we can discuss out of
Okay.
We can assist her.
Okay. A question here for a couple that the rhesus kuna incompatibility ya rhesus factor. How long does it normally? How long would the baby survive? And if it would, at what point would the baby die?
Let me tell you, baby die at what point? I think the thing is,
it's how we are saying how long would it take for the baby to die, but it's very like we should.
I think that's a wrong thing. But there are those pregnancies that come out, but the first pregnant, you need to have anti-D.
So if that doesn't happen, if the mom doesn't get an anti-D,
it can happen at any time. You
Also, it
can
doesn't
give
have it at
birth, the
2
pregnancy can
months.
come out.
Okay.
There's no specific time. But what I can encourage that person to ensure that they go to the clinic, they get anti at the right time.
Yeah. But I feel like the thing is, we shouldn't be losing babies.
Yes, also, because already there is a remedy.
Yeah.
There is something we need to know.
Yeah.
There is nothing that does not have a solution.
Yeah.
Wacha tuende hospitali.
Yeah.
I'm encouraging. The basic thing is tuendeni hospitali, tupimwe, tuambiwe, we get the right information and we get the right management.
Yeah.
And then we avert maternal death and
For
neonatal
sure.
death, and we'll be sitting down to discuss, like for the last 1 year, we have not had any maternal death or neonatal
That
death.
would be so good.
That will make my heart be
Yeah,
at peace.
that would be so good. Because,
Nikisikia ati tumekaa like 3 months, 5 months, 1 year without maternal
Yeah.
neonatal death, that
That
would
would
be
be
my
amazing.
happiest day.
because even just talking about it is really heavy. You know, just the thought of a baby would die before delivery or immediately after delivery, or the mom, and I'm wondering what happened. I'm just praying that we get to a point where we all have the knowledge of what exactly we're supposed to do and avert these. So
Every
play
death there's
your
a
part.
cause.
Yeah.
Every death, either maternal or not, there's a cause.
Yeah.
And that cause can be averted.
So let's all play our part.
Let's all play
correctly.
our role.
Yeah. Maswali zimekuwa nyingi. Quick fast, in a minute. Anasema anatoka Likoni, ako 5 months pregnant, but anashindwa kukula. Amejaribu supu, amejaribu liver, but ameshindwa kukula. Anza nifanye nini?
Please let her
What do I
try
do?
and eat. Mwambie akule tu, anakula ile fundi anajua it's not nauseating.
Yeah.
Because most of these things are nauseating.
Yeah.
If it's fatty food, if it's, let her eat the food that she feels
Yeah.
is not nauseating. And force herself to eat.
Yeah. Okay. Is it normal for a baby to kick after every second?
Yeah, there are people who are very active.
Yeah.
Yeah, they
Okay.
can play and play and play. But of course they also sleep a lot.
Yeah. Okay. So hiyo imejibiwa, kwa hivyo do not worry. Tuko na Samuel, why do babies cry usiku wakati wamezaliwa? Kwanza anaitwa Samuel. I'm sure it's a dad. He's wondering. why is the
Alalangi
baby
huyo.
alali?
And they want to sleep.
Yeah.
How do I explain that? Because you see, I think I've seen different babies. Most of them may be sleeping during the day, the other one sleeping at night,
Yeah.
and they have those colics. Najua katumbo kachozoea.
Yeah.
So they have colics. And I think out of these colics, that is where people misinterpret with akushiba. Huh? It goes. Within 4 months it goes. They
Yeah.
get used to it.
Yeah.
Tell him to take care of the baby. I love that. It
With
will
time
go.
itaenda.
Itaenda too.
Yeah.
And they are not supposed to give that baby food. Acha kanyonye,
Yeah.
kalie. It will come to an end.
Okay.
That's what I encourage.
Perfect. Now, in the interest of time, what would be your message to mothers, fathers, and the community at large in matters regarding maternal and neonatal health?
Let me start by saying this. Mothers and their babies should be a priority in our community.
Yeah.
Because one death of a mother or a baby means a lot in a community.
Yeah.
In terms of direct and indirect cost, direct and direct psychosocial effect. So, the role of a community is to support these mothers,
Yeah.
to work with them during this pregnancy. The role of that mother is to ensure that they follow the instructions that are given by healthcare workers. Go to the clinic when you are due. Take supplements when they are due.
Yeah.
Ensure that there's a communication between you and the baby. This is the way when you're driving a car, you communicate.
Yeah.
Nimesikia ka, nimesikia ka, gea ingi. You know,
Yeah.
you need to have that kind of communication with your baby. Leo mtoto wako kucheza, leo mtoto wako, leo kuna,
Yeah.
leo, you know, and also your body.
Yeah.
What is it that you're experiencing? When you're feeling unwell, visit the health facility.
Yeah.
Then again, interact with your form the group. Is a support system.
Yeah.
The support system. Talk to healthcare workers.
Yeah.
Ensure that, like, I'll encourage mothers. There are those who come from far. There's no facility that is near where you live.
Yeah.
When you're pregnant and you know you're a high-risk mother, please go to a place where you can be taken care of just in case of an emergency.
Yeah.
Have a high index of suspicion on how you are feeling in yourself. I'm sure in future we want to have a situation whereby our high-risk mothers, we can even admit them even before their due date.
Yeah.
We take care of them, they come together, they support one another.
For sure.
That is what we are looking for and to have.
Okay.
Because some of these, maybe the transport system, mtu ametoka kule interior, labor pains comes at night.
Yeah.
There is no even border to take them, there is nothing, then they end up with complication. But if this was prepared before, we can have a way of trying to ensure that this mother have some safe transport, safe deliveries. Saa ingine hakuna network. You're in a place you can't even call your CHP. But those issues now, they are being taken care of because we have been having discussion even with Safaricom to ensure that those areas without network, they also have network. Then register for SHA. Register for SHA.
Yeah.
Let's support our president. The system is so good if we all adopt it positively.
Okay.
We have seen it's paying well. We have seen even our CS so passionate about it. We need to be honest with what we're doing.
Yeah.
We need to have a family of health people. And for us to be health, we have to support the system.
Yeah.
I think that is my parting issue. That is what I can say.
Yeah, I love that. Now, for the people who've had today's discussion and they know for sure that they need to get checked or they're pregnant and they now know they need to go and just monitor their pregnancy even as they continue, how would they be able to reach you and what are some of the facilities that they'd visit in Nakuru?
Nakuru County, we have around 219 facilities.
Yeah.
And we have CHPs all over. I would like them to link themselves in a certain facility and a certain CHP.
Yeah.
By doing so, I may give my number, I may give the emergency number or something, but the nearest person who can assist you is that CHP who is there because they know the referral system. We have adopted a very good referral system whereby a CHP realizes there's something, or even a chief in a community. You know, chiefs knows everyone. Mzee wa nyumba kumi, because those are now the people we need to bring on board in case there is something. And then they can link them to a facility. They know who to call. Sometimes an ambulance might not be available at that point. But kuna gari ya polisi iko pale. Kuna neighbor who can. We need to go back to assisting one another. If my car is parked there and the ambulance is not able to come at that point, coming and going back, let's use our vehicles to and that's why I'm saying let's support our mothers. Support means both socially and in material things. Tutumie gari zetu kusaidia wamama kwenda kuzaa, even at night, even during the day. That's
Very
what I
important.
can say.
Perfect. Do you have a contact that we share for today?
I don't want to share, but for those mothers who have asked direct questions that need to be answered, after this you can share my number. Those specific mothers who need, I think I need to follow up with them after this, because I don't need to come here and leave this place without helping even that someone who really needs some help.
So what we'll do, if you're there and you know that you need the contact, you personally need to have this conversation, please text. I've seen you already have some that we'll be sharing, but if you're going through something and you know that these you need to share with someone and just get help, text us through our WhatsApp number. That is 0721 105 105. So just talk to us, tell us what your issue is, and we'll be sure to connect you to Madam Joyce so that you'll be able to get help, because that's very, very, very important. Hope that's clear. So thank you so much for coming. It has been such an informative show. And I hope that it has been informative for you as well. So thank you so much for tuning in. We've been here from 7:45, where we started with some music, and then we got to get into the discussion where we're talking about maternal and antenatal health. I hope that and neonatal health. I hope that that has been of help to you. We've talked about what we should do to reduce the death rate of our mothers and the children. And I hope that we've been able just to know what exactly that we need to do. Sawa sawa? Now, if you've not been able to join us properly, it's now that you're joining us. we'll be joined by Sarah Mumbi, who will be helping us to just go through the pointers right from the beginning, everything that we were able to talk about, some of the things that we talked about while we started and we weren't able to do all that. But of course, before we do that, we'll be looking at the Did You Know segment. So let's get the Did You Know segment that will jog our minds kidogo, even as we get to look at the pointers and to go through what exactly we've talked about today. All right, so we have the Did You Know segment. So this particular amazing segment helps us with getting to just jog our minds kidogo. And now here you'll have to go and research more. Yeah? So this is to just jog our minds a little bit. Now, did you know that the youngest known mother in medical history was 5 years old? Wow. Doc, did you know that? Because 5 years old is young. So 5, surely. Yeah. And it does? Yeah. Because 5 years old is really young. And it was Lina in 1939. 1939 was kitambo sana. So did you know that the youngest known mother in the medical history was only 5 years old? Her name was Lina Medina in 1939. That's something I'd also want to go and do more research on. So especially for the medics that are listening or the people who are interested in the medics, please go and research. Okay? Go and research so that you know. But did you know that the youngest mother in the medical history was only 5 years old? Did you know that?
I did not.
Yeah?
No, I did not.
Now you
it's
know.
Quite surprising, by the way. 5 is very, very...
Because 5 is really young.
5, ajafika hata class 1.
Yeah.
Yeah, because grade 1 is 6 years old.
I was just about to tell you, class 1 is not CBC.
Oh, yeah.
Yeah.
Sorry, me. Tulishatoka kwa system. So kidogo, you forget.
Yeah.
Yeah.
So class 1 should be grade 1 now.
Grade 1.
It is.
Yes.
Yeah. We need a lot of
catch up kidogo with the
now.
system.
Yeah. How are you doing?
I am amazing.
You've been well?
I am blessed.
Yeah.
We thank the Lord.
Amen.
Yeah.
Maybe it's a good thing to tell the people that you're the one who've been making the pointers for us. Diana
with Brenda.
With Brenda.
And the whole team.
And the whole team,
yeah.
Of course, which is really amazing that we do this together. Have you been?
I have been great.
Yeah.
It has been really nice, making the pointers. You learn a lot, by the way.
Yeah.
We are ignorant to so many things until you start learning about them and you realize, I didn't even know that, and some of the things unajipata you do. Kama tumeambiwa kuhusu health seeking practices. I am guilty, guys.
Right?
Yes.
At what point do you usually go to hospital?
When it's bad, when I feel like
when I'm going
yourself, yes.
When you have to, your mom or your dad has to take you there.
Hadi unabeba, that's when you go to the hospital, and I think it's very bad.
Yeah.
And it's our culture as Kenyans.
Yeah.
We should change.
Yeah.
We
need to do better.
Yeah. See, headache, mara moja headache again. Ukipata headache at least twice. That time inafaa kukupata in hospital. You don't wait.
That time.
Yeah. Okay. So the second time.
The first time.
Because sometimes you get a headache and it's maybe you've just been exposed to too much light, you've done a lot of work, so you're like, I have a headache, let me take a mara moja.
Yeah.
But like ukianza kusikia imerudi tena ama it's 2 hours, you still have a headache.
It's persistent.
It's persistent.
Yeah.
Yes, that's the word.
Yeah.
You go to the hospital.
Yeah. What has been your takeaway from today's conversation, even without the pointers? What's something that you've taken from today's conversation?
Yes. Point, I repeat again, this health-seeking practices has touched my heart.
That has touched you. You can tell you're guilty there. That you can tell you're guilty.
Yes, and also taking care of your body before pregnancy. Like most people, I've heard of it, but it was such an over-there concept. Things that people do over there. But now I'm like, it's actually something that you need to do.
Yeah.
You need to consciously plan to become pregnant, to carry a pregnancy, to take care of your body. If you are a bit on the heavier side, for you to lose weight, to take your vitamins. Yeah.
And these are things that you don't do daily.
There are things.
But I think from today's conversation, this is something that you should start practicing already.
Yes.
So yesterday I was having a conversation with someone, just in case she's watching, and she said, if you realize that your calcium levels are down, as a young girl, start working on them right now.
Sahi.
If you notice your iron levels are down, as a lady, start working on them right now.
Yes.
Yeah. You're probably not married. You're not planning on getting a kid. Of course, if you're not married. You're not planning to. But if you realize there's something that's
wrong with your health.
Yeah.
Yes.
Start working on it right now.
Yeah, because I've had stories of people who say, I think I have an name. They're not even sure. They're like, oh, najua nikinama, I feel kizunguzungu. But they're just like, as long as I'm alive and well. And yeah, they don't take it seriously. And then now they become pregnant and now they have all these other complications that could have been solved beforehand. Yeah.
We need to do better.
We as a society, as a community, and as individuals. Yeah.
Perfect. So we're here to go through some of the pointers that we've gotten from today's conversation. And this is to you who's not been able to join us a bit earlier. I'm only to join a bit earlier, but the things that maybe zimekupita hapa ama pale. So because of that, Mumbi has been able to, would you want us to address you?
I use all my names.
Yeah,
I use all of them.
At this point.
I use all my names.
So Mumbi, correct. Now, we have the pointers that Mumbi has prepared for us, and we'll be able just to get the things that we need to learn from today's conversation. Please go ahead.
Yes, so the first point is maternal health refers to the well-being of women before conception, throughout pregnancy, and during delivery. And this is just now back to the point of before conception. What are you doing now in preparation for you to carry a child to full term? And as a pregnant person, are you going for clinics? What are you doing with your health? During delivery, ushajipanga. You know, there are people who wanangojeanga tu inawashtukia. It's delivery day, you knew about it, and you were not well prepared. So it is important for you to prepare before, during, and after. Yes.
Yeah, I love that. Especially the before part.
Especially the before part.
Because most of the many women don't prepare beforehand. And as Doc said, the pregnancies that are planned. So for the planned ones, prepare. For the unplanned, tunaomba Mungu kuko sawa. But ukirealize, immediately go to hospital.
Immediately you realize you're pregnant, you go to hospital now, so that if there's anything, we catch it early. Yes.
Okay.
Maintain consistent prenatal visits to safeguard your health and allow early identification of potential complications. Just echoing the first point, unasikia mtu, it's now delivery day and now they have preeclampsia. They have issues that could have been sorted out way earlier. Unaambiwa, you know, even your child has malnutrition. You're like, oh, I didn't know. So be consistent, be proactive, and very intentional with your health. And also be conscious that you're carrying another person's health in you. Si wewe peke yako. Mko wawili sasa. Yes. So ni kujituma kabisa.
That's heavy.
Yeah. Next, we have the leading cause of postnatal death is postpartum hemorrhage. Tumeambiwa most people die because of bleeding during delivery. So we are discouraged from giving birth at home. You know, squeezy people even hire like a private, they're called doulas. Akuje tu, you want a water bath. There's so many things this day of the internet. So many things you see on the internet and you're like, I'm not sure this is healthy. Like if something was to go wrong now, the nearest hospital is 1 hour away. Utafanya nini? So just to be safe, seek professional help. Go to the doctor, plan yourself, have your OB, don't miss your appointments.
There's something that you've mentioned. We'd ask this on air. Doc, there's something about water bath, so bear with us. Let me just ask this question because I know that you want to know it as well. Water bath. Is it something that you would advise? Water bath.
Water bath.
Yeah, water bath. The people who
they want to give birth in like a pool.
In a tub.
It allegedly reduces pain.
Okay. So the next time, preserved. So the next time you're having this conversation, there's a day, and I pray that day we'll be able to have a panel. But on that day, we'll be talking about the do's and don'ts during pregnancy and after pregnancy and before pregnancy. So we'll be able to talk about all that. So that question, make sure umetukumbusha hiyo siku. Continue.
So our next point, we have Cultivate safe and proactive health-seeking behaviors. Again,
That's for you.
For me. That's the main point. The main takeaway is to cultivate safe and proactive health-seeking behaviors. Usingoje kusikia ni kama hata you can't even stand up straight. That's when you're going to the hospital. Yeah.
Have we had that, please?
So, I, as Mombi, I have noted.
Thank you.
I will not wait.
Thank you.
Kitu kidogo hivi hospital. And then also like for people who work in chemists, nini, watu wanauzia watu hata drugs. I know of a person who self-medicates on malaria pills. They're like, nasikia joint pains, sijui ni headache, I think nilimwa na mosquito. And they go and buy, they've done it so many times to the point it's become a concern. And I'm like, nani anakuzianga hii? You just go and you tell them, nataka diama, and just give it to you. No prescription, no nothing. Like, and it's quite concerning. So, inafaa kuwa responsibility ya each and everyone, from the the health service providers to you as an individual. Watch it. Stop treating the symptom.
Dr. Mombi. Dr. Mombi. Love that. Maybe it's time we talk about antimicrobial resistance again.
Yes.
I think we keep forgetting about it. We self-medicate
over and over again.
And then many people are okay with taking tablets and
oh, you are the injection type?
Yeah.
Oh, I'm the tablet type. I'm sorry. Hey. Because if there's an option, I will not go for the injection.
Oh, really?
Yes.
I don't like taking tablets.
I prefer tablets.
But then, either way, we're not supposed to be taking medicine. Self-medication is wrong. Over the counter is wrong. So it's time we talk about antimicrobial resistance again. So we'll create a show for that specifically.
Yes.
Tukumbushe
watu, sensitize them, speak about it over and over and over again until we get to a point where no one is self-medicating. Yes.
Very important. I hope we'll get there as Kenyans because Dr.
I really hope.
With the ChatGPT era.
Yes.
My goodness.
So our next point is a healthy mother starts with a supportive community. Yes.
Love that.
This is like summing everything up.
Yeah.
A healthy mother starts with a supportive community. As we've been told, like as a member of the community, tumia gari yako, peleka the pregnant mother to the hospital. You know, take care of them. Even learn about what they need. Like you're in the house with a pregnant person, hata wasaidi kazi. And some, I know, pregnant women, they're strong. Some can work until 9 months. And so we just tend to assume so many things. So as members of the community, we should be very, 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 very conscious and also offer help to pregnant women.
Yeah, I love that.
Yeah, and we should also applaud the government of Nakuru. Wamefanya kazi mzuri sana, led by Susan Keheka.
Actually,
nimefurahi kabisa. Hadi I had to go on my phone to Google more. Check. Yes, I'm like, wow, I did not know this.
And there's something that Madam Jace has said, and she's the CEO of public health in Nakuru. And you know, public health really affects each and every one of us. Public health is what we do on a
daily basis. It's your life.
I remember, I know she's here, but you can just talk about it. Hey, I remember there's something she mentioned about having hotels that are not very hygienic. They're not hygienic. Yeah. And she was just talking about it, and I was thinking, Nakuru, we are at a better place right now. If I try to think about Kitambo, even in our villages,
back in the day,
ungeenda kitchen in a hotel. And that's why
they were so bad.
They were so bad.
People would joke and say, ukienda kitchen ya hoteli, you can't eat the food. Because it was that bad. If you see where the sufuria they're using to make your food,
and that is why we had outbreaks. Zenye haziishi. But
cholera, typhoid, every day there's something.
But where we are at now, we are at a better place.
We are at a better place. We are growing, we are learning, we are evolving. And I love that for us.
So just applaud them as well, but also each and every one of you for what you're doing, because it's also at a personal level.
Yes, it is. You take initiative for your own health. Unaamua, I want to be healthy, and because I want to be healthy, I'll do A, B, C, D, E. I will eat healthy, I'll take care of my health, my environment, I'll be hygienic, and I'll do all these things for me. Yes.
Perfect. Absolutely love that. That was such an amazing segment where we just go through everything that we've done today. And for the people who weren't able just to go through everything or to join us from the very beginning, now I know that you've gotten to learn what we have been talking about today. But you can always go back to our Facebook page and YouTube page right from the beginning. Listen to everything that we've said, because that is of importance to you, to your wife or your husband or to whoever and the whole community. It's very important to all of us. So thank you so much for tuning in. Thank you so much for being here right from 7:45. This has been Afya Clinic, where we've been talking about maternal health, just to make sure that as mothers you're healthy. The kids that we birth, they're also healthy. That was such a good way to say it, but they're also healthy. So just make sure that you're taking your parts in the community to make sure that you're having a healthy community.
Yes.
Thank you so much for taking us through that session.
You're welcome.
Yeah.
Until next time.
Until next time.
Yeah.
Until next Wednesday.
Until next Wednesday. Same time, same place.
So do not miss out. But of course, for that, do have an amazing rest of the week from tomorrow and Friday, and then the weekend, of course. But we'll see you next week on Wednesday. So remember that we'll be having our lunch hours from 12:30 to 2:30 p.m. So do not miss out. Again, I will just repeat that last week we had such a power-packed week where we were praying for the mountain of media. I'm really praying that we won't just get over it like we didn't do anything. I pray that we will stay in the moment, that we will grow, that every word that was put in our heart, that it's going to, grow 100-fold, and that we'll see the fruits. Yeah, so I pray that tutakuwa tu. Also, I'd encourage each and every one of us to go and listen to the morning devotion. Yeah. So just to remind you that this month they're talking about suicide prevention awareness month. And you heard Pastor Elid explaining it very well. So please make sure that you go and listen. It will be very beneficial for you. That's it and done. Thank you so much for being here. My name is Rachel Kahugo.
And my name is Mumbi Karaoke.
We'll see you
until next time.
Bye-bye.
Bye-bye.